Today, I want us to talk about something that many people live with quietly and bravely every day. That is chronic pain. And I want to start by saying this clearly. If you're in pain, your pain is real. Even if scans are normal, even if blood tests are normal, even if no one can see it. One of the most distressing things patients tell me is, Doctor, they said everything is normal, but I'm still in pain. Does that mean it's in my head? No, it does not mean that at all. Pain is not just about damage. Pain is how your nervous system interprets signals. Sometimes there is an injury, sometimes the injury has healed, but the pain system stays switched on. It's a bit like a car alarm that keeps going off even when the danger has passed. That's what chronic pain often is. Not imaginary, not weakness, but a nervous system that has become overprotective. When your GP orders tests and they come back normal, it doesn't mean nothing is wrong. It means we've ruled out the dangerous causes like cancer, infection, fractures, or severe inflammation. That's actually reassuring. It means we can focus on helping you live better and not just hunting for disease. Chronic pain is usually defined as pain lasting more than 3 months, and it can affect your sleep, your mood, your work, your relationships, and your confidence in your body. So we treat it as a whole person condition, not just a physical symptom. Chronic pain care is multidisciplinary. That means more than one type of support. This might include pain clinics, physiotherapy, psychology, medication, lifestyle changes, pacing, and movement therapy. Not because pain is mental, but because pain lives in both the body and the brain. Let's talk about medication honestly. Pain medicines can help, but they are rarely the whole solution. Strong painkillers, especially opioids, are used cautiously because they don't always help long term pain. They can cause dependence and they can worsen sensitivity over time. So, modern pain care focuses more on movement, retraining the nervous system, emotional support, sleep, and confidence in activity. And that word movement is important. When you're in pain, everything you want to rest and protect. And that's natural. But over time, avoiding movement can make pain worse. Gentle, supported, graded movement teaches your body it's safe to move again. Another important part of pain care is pacing. Pacing means not doing everything on your good days and collapsing on your bad days. It means learning steady, balanced activity that protects your energy and your confidence. Pain clinics often talk about pain acceptance, not in the sense of giving up, but in the sense of understanding your body. So pain stops controlling your identity. I want to speak directly to anyone who has felt dismissed, You are not dramatic. You are not weak. And you are not imagining things. Chronic pain is one of the most complex conditions in medicine, and it deserves respect. As a doctor and as a governance lead, I can tell you this: the NHS is increasingly focused on compassionate, evidence based care, but it takes time and it works best when patients feel heard. So if you're living with chronic pain, ask about the pain clinics, ask about physiotherapy, ask about psychology support, and ask about pacing and movement programs. You deserve more than just tablets. And if you support someone with chronic pain, believe them, support them, and don't minimize their experience. If there's one message from today, it's this: pain is real. Even when tests are normal, and healing doesn't always mean curing. Sometimes it means learning to live fully again. I am Dr. Jide, and this is Health Conversations with Dr. Jide, helping you understand healthcare one conversation at a time. If this episode resonated with you, please like, share, and subscribe. And in our next episode, we'll talk about something many people worry about: respiratory problems, asthma, breathlessness, and when to seek help. See you on the next episode. Bye.